Of course, it's not only equipment that we're looking at. We need to look at the other elements of the system that we need to focus on and build upon.
Theatre is never used for operations.
One of the essential elements of the plan is to address our human resource planning.
Though I'm sure they are not yet enough. Well, I should think that this place needs some more doctors. More special nursing staff. It's very short. We're running short of nursing staff.
Why is this room empty?
I'm working alone this maternity ward, so no second nurse to help me. So if there is a second nurse, I'll open this one as second nurse.
Your refreshing surprise is disguised by their lust for wealth.
The problem of low salaries in South Africa, so they are running away from it.
Was the money you made enough to buy back your soul?
When we recruit doctors to the rural areas, it's difficult to retain them because another province will offer better salary, for the same doctor working in the same field as us, and that makes life very difficult for us.
Yeah, Transkei needs more doctors, needs more nurses. Nurses are leaving this place for better countries, for greener pastures. Even the doctors are leaving this place for greener pastures.
There are no greener pastures in this.
Yes! Not this one. There's no money. There's no money. Yeah, there are greener pastures by the mere look with the eyes, but there's no money in this place. You see?
Endorsing or being endorsed for their industry.
So we are trying to address the situation through the newly launched human resource framework that has been launched by our minister.
Transkei Health Department of Health is in urgent need of new young doctors. Here in St. Elizabeth, you can be trained in all faculties, and I think coupled with the rural environment, you'll be at the right place in helping people.
We should also look at nurses and therapists and other health workers, and the training should be for the whole health team and not just for doctors.
In trying to do that, we are finalizing a framework that will look at the overall strategy of human resource development and management.
No, not community service. That hasn't been filled for a few years. Anyway, since I came here, I saw only one South African sort of settle taking a run. He just came, saw the road, parked his bins back again, and went off.
Oh, no.
Yeah, he didn't like the place.
Well, that's another reason we're making this video, so that people can have a realistic idea of what it's like, so that we attract the right kind of people.
There is, for instance, a program that we have put in place in terms of our human resource strategy, and this is looking at basically marketing ourselves as the Eastern Cape so that we can be able to recruit and retain professionals.
Main challenges that we have is not that there are no doctors around. The problem is the institution has no capacity to retain doctors because of infrastructural problems. You might have noticed the road from Taro to here. It's not so good. And again, the problems around communications, transport. So those are the main things that fail us in terms of retaining the professionals.
That program is funded to the tune of 373 million. And of this, 127 million is focused on projects and programs related to health professional training and development.
There's everything here, every pathology that you can think of. And we have good machinery, it's just that we don't have personnel.
The second area is recruitment and development of medical specialists. And here we'll be marketing and highlighting career opportunities that are available in the Eastern Cape.
Ability to learn, I can say yes and no. Yes and no. Yes, because we've got many opportunities to improve ourselves.
And through our health resource centers in Umtata, Queenstown, East London and PE, we will be able to support district hospitals, LSAs for this kind of development.
But no, because like I'm studying, I'm studying online and it's not easy here. And then I have a roster. I have to work every 2 days and every 2 weekends. But if I'm here and I'm not on call and there's a patient, they call me, I cannot say no.
Yes.
So I'm obliged to come in to attend the patient.
The next area is strengthening academic support to registrars in PE, East London and Umtata.
We need more people from outside so that we can go gain more knowledge. And even those people who are from afar, well, I should think that by coming down here, they will learn more about our cultures and our diseases, so that we can make so many researches.
The anesthetic training program coordinated by Dr. Lionel Smith.
What we've done is to get doctors from the rural areas to come into the obstetric theatre at Livingston, and they are initially shown what to do and then secondly under supervision allowed to do. Coupled with that is a theoretical program with regards to what they're doing, what they should watch out for, and they're encouraged to have hands-on experience, as I said, under supervision. And we find that young doctors who are giving anesthetics and are doing the work benefit just by this 2 weeks.
This program is unique in that once officers have completed a 2-week practical course in PE, Dr. Smith goes out to institutions to assist the officers in implementing what they've learned.
It has interesting spin-offs in that doctors learn about new techniques, new monitoring devices, new drugs, new equipment, and they take those needs back to their hospitals, and so they start a chain reaction of upgrading their hospitals in terms of equipment and drugs as well.
The focus areas include the provision of centers of e-health education and research coordination. Secondly, the implementation of fully functional e-health package in district hospitals with connectivity with all clinics.
At the moment, we see a lot of government commitment towards rural areas. There's commitment to get things going, there's commitment to put money into the area. However, there's a lack of people who have the skills and the motivation to actually implement it.
Yes.
So it would be great to see some young professionals coming to this area to help, to utilize these resources and to shape a better community in the rural areas.
Yes. RuDASA stands for the Rural Doctors Association of South Africa. It was 10 years ago in the Eastern Cape at Butterworth, and the aim was to provide some sort of support network to rural doctors. However, the membership isn't limited to doctors. In fact, anyone can join RuDASA, and its aim is to get together people who are interested in rural health and see if together you can make a bigger difference than just working alone.
A key strategy for RuDASA should be to promote student interest and involvement and possibly into a career choice in rural medicine.
We discussed a lot of issues quite wide-ranging with regard to recruitment and retention. How to attract doctors to rural areas in the first place, and then how to keep them there, how to make it sufficiently attractive for people to stay, both from a family point of view and from a professional point of view.
So there's about 10 photos of the beach, 10 photos of horse riding, 4x4 trails, things like that. So we sold the lifestyle, we didn't sell the product.
Specifically, rural electives should be actively promoted. That the attendance at RuDASA conferences of students should be amplified a great deal. That people felt it was a very formative experience.
Encouraging students from rural origin to like rural medicine, encouraging any student at the university to like rural medicine, In other words, to inspire. The word which was used was to inspire.
We need to inspire rural scholars to study medicine. We need to inspire rural doctors who are already there, and one of the ways to do that is mentoring. And then we need to inspire young doctors to come and work in, young and more senior doctors to come and work in rural hospitals.
This is the ideal place for young doctors to come. It's big enough to get good supervision, and we've got specialists in all the faculties.
It's an extraordinary exposure, especially if you come from a more urban environment.
In a certain way, the more remote rural hospitals have got a better culture of learning than some of the other hospitals in the country.
Ik maak het gewoonlik so vas. Maar dis ou kiel. Val dan net so uit. Dr. Jones.
Sister, we are doing all clean cases in this theatre. There's our new modernized post machine, theatre table, there's a neonatal resuscitation, lamps, and what is it? Emergency trolley, with all the drugs here. These are the emergency lights. When there's no electricity, they take over. This is our scrub room, where we scrub before we are doing the cases.
These are the two old anesthetic machines and the mobile x-ray machine, and it's not used at the moment.
And there is a lot of patients with very, very neglected disease. People come late to hospital because they're very poor. And you see extreme pathology.
Okay. All types of diseases what you will never meet or see again.
As we've been heard over the radio that we've got septic circumcisions.
Because it's the initiation time now.
Yes, because there was that outbreak.
Which as a young student is a challenge to deal with. Many things you've only learnt about in your curriculum from textbooks you actually see here.
You just hear the horror stories and think, oh gosh, crazy to go out there. But you get out there and you actually experience the horror stories yourself. And you just learn to deal with it, you get on with it.
Use your eyes, use maybe even your nose, use your stethoscope, use your fingers for palpation or examination the patient, because that is what you have here.
And I learned very much by just being forced to deal with the patient. They were your responsibility. You didn't have somebody senior who would look over you and would take responsibility. And that forces you to actually keep on learning and really becoming a doctor that can cope with stress.
Yes. Wat het met hom gebeur?
Hy is gebyt deur 'n hond nou net.
Oh,
Mika. Dis 'n klein nou bytjie. Ons gaan gou vir 'n pleistertjie opsit dat hy weet so.
Plasta,
some medicine. Push medicine, yeah? Anyone else want plasters?
Apart from needing a lot of doctors for this area, we've also got a shortage of pharmacists. We've now recruited people from the community to be trained as pharmacist assistants.
So this lady is working here.
Oh, really?
Hello.
Pharmacist assistant.
But each pharmacist can only train 5 pharmacist assistants. So now we can't include more pharmacist assistants because we don't have pharmacists to train them.
It's the traditional medicine, man. Yeah.
Hola. Yo. Feeling alright.
Learned traditional medicine from his father, and now he's mixing this. He's not a traditional healer or sangoma, but he's selling these medicines, and they range from this interesting mix that you can throw into the fire to dispel the angry spirits, and all of these that are edible or drinkable to certain degrees.
3 teaspoons in the morning, 3 in the afternoon, and 3 at night.